Hey guys, welcome back to my channel, the ENT Resident. Today I'll be discussing about these two phenomena that we see in otology, and that's Tullio phenomena and Hennebert's sign. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. What is Tullio's phenomena? Tullio's phenomena is basically this clinical sign that we elicit by sound stimulation. Here, we notice vertigo and nystagmus getting induced by loud sounds. And this is a condition which is classically been described in superior semicircular canal dehiscence. But there are also other conditions where we see it, like perilymph fistula, Meniere's disease very rarely, cholesteatoma with labyrinthine fistula, and congenital syphilis. Now, what happens here exactly? Now, normally sound should only be stimulating your cochlea, right? In Tullio's phenomena, what happens is the loud noise. Whenever we are giving a stimulation of loud noise, it is going and stimulating the cochlea, but at the same time, it is also stimulating the vestibular system. Now, because the vestibular system is also getting stimulated, the patient ends up developing vertigo, nystagmus, imbalance, and nausea. The key concept that is involved over here is known as the third window effect. What does this mean? So normally in anatomy, we know that our normally inner ear has two windows, the oval window and the round window. In superior semicircular canal dehiscence or fistula, for example, a third opening exists. Because of this third opening, what happens is the sound pressure goes and stimulates the vestibular system abnormally. And that's why we see the vertigo and nystagmus in these cases. That's what Tullio's phenomena is. And this Tullio's phenomena, it is an eponym which is named after Pietro Tullio, who was the one to describe the sound-induced vestibular responses in experimental animals. So this is what Tullio's phenomena is. And one more thing is, what else do you see? One MCQ question here is, what else do you see in superior semicircular canal dehiscence? So we see Tullio's phenomena, we see autophony, and we also see conductive hearing loss. So this is what Tullio's phenomena is. So the next one it brings to us is another case of vertigo, but here instead of a sound induced vertigo, we are seeing a pressure induced vertigo. And what is this sign called? This is known as the Hennebert's sign. So what is Hennebert's sign? Hennebert's sign is a clinical sign that we are eliciting during vestibular examination. So what we see here is vertigo and nystagmus getting produced by pressure changes in the external auditory canal despite the absence of a true labyrinthine fistula. This Hennebert sign is essentially a false positive fistula test. And where do we see it? We see it in congenital syphilis. This is the classic example of Hennebert sign. And we see this in congenital syphilis because of the presence of hypermobile stapes footplate. Next, we can also see it in Meniere's disease because of the fibrous band connecting the utricle to macula. And we can also see it in superior semicircular canal dehiscence. Now, what happens here exactly? We know about the fistula test. So, normally, the fistula test will be positive when there is an abnormal opening between the middle ear and inner ear. But in Hennebert's sign, what we are seeing is, even though there is no true fistula present, the fistula test is coming out to be as positive, meaning false positive is happening. So in Hennebert's sign, when we have applied pressure in the external auditory canal, we are changing the pressure in the external auditory canal by either pressing the tragus or with the help of Siegel's speculum, we are seeing that vertigo and nystagmus is occurring even though there is no actual bony fistula present. This is because the pressure is getting transmitted abnormally to the vestibular system due to some pathology of the labyrinth, which can be, as in I have mentioned, in congenital syphilis, Meniere's disease, and superior semicircular canal dehiscence. This is what Hennebert's sign is. And this was named after Hennebert, who was the one to describe this phenomena of a positive fistula-like response without the presence of an actual fistula, especially in congenital syphilis. So this brings me to a few more MCQ questions related to this. So this we know that Hennebert sign is the false positive fistula test. So where do you see a false negative fistula test? We will see this in case of a dead labyrinth or if a fistula is covered by a cholesteatoma, a polyp, or some granulation tissue. And a true positive fistula test is seen in case of a lateral semicircular canal fistula. So that's all about Tullio's phenomena and the Hennebert sign. If you have any doubt regarding this, you can note them down in a comment section and I'll get back to you. Thank you.